So a mastectomy is a surgery in which we take out all of the breast tissue. There are moments where a mastectomy will be necessary, which means that a patient will not be a candidate for breast conservation or lumpectomy. And that would be one, if the cancer is multicentric, which means if the cancer is sort of scattered throughout the breast. And if a patient has any medical conditions that would preclude them from getting radiation, then they would need a mastectomy from the get-go. When we talk about mastectomy as a surgery for breast cancer, we can talk about different types. One would be total mastectomy, which is a surgery where you take out all of the breast tissue, sometimes with the nipple and the areola, and sometimes you will leave a large portion of skin behind. That would make it a skin-sparing mastectomy. And the idea there is that we're trying to leave as much skin as possible so that the reconstructive surgeon can create a breast mound that looks as much as the breast looked before surgery. Another type of mastectomy is a nipple-sparing mastectomy, otherwise known as nipple areolar sparing mastectomy. And the idea with this surgery is that you're removing the entire breast tissue while leaving behind both the skin and the nipple areola complex. And again, the idea with this surgery is that you're trying to make the breast look as much as possible as how it looked before surgery. Unfortunately, not every single patient will be a candidate for this. The majority of patients will get either a total mastectomy or a skin-sparing mastectomy. Another type of mastectomy is something we call a modified radical mastectomy, and that is a term that will include both the total mastectomy, which again is a surgery that removes the entire breast tissue, and it will also include excision of all the axillary lymph nodes under the arm. We do know that if you do get a mastectomy, the chances of the cancer coming back or having what we call a recurrence is very low, in the range of 1 to 2%, but it's never zero. And so it's important for us to drive that point that when you decide to choose a surgery, whether it be a lumpectomy or a mastectomy, in the majority of cases, your overall survival will be the same, but you're always going to have follow-up, whether it be with your surgeon, whether it be with some imaging, either a mammogram or an ultrasound.